Hello, everyone. Today I'll be talking about anabolic and androgenic steroids. My name is Kevin Murgia, and this is for HSC 227, Drugs and Health. So firstly, what are anabolic or androgenic steroids, which I will also call AAS throughout this video? Anabolic steroids are synthetic substances similar to the male sex hormone testosterone. Steroids promote the growth of skeletal muscle and the development of male sexual characteristics in both males and females. Some people abuse anabolic steroids to build muscle and enhance performance. For the most part, illicit steroid use is linked to athletic competitions and/or an athlete trying to gain a competitive edge. But sports and athletic competitions are not the only place steroids are used. Outside of sports, they're used because someone wants to alter his or her physical appearance, usually based on distorted perceptions that he or she is obese, underweight, too weak, or other personal views. Located below for anabolic and androgenic steroids, I have listed the definitions for each of those. So a little bit of history on AAS. AAS is the history of anabolic steroids can be traced back to as early as the 1930s before the term steroid was even used. In the 1956 Olympic Games, Soviet athletes, especially wrestlers, performed at exceptionally high levels. After learning that these athletes were using testosterone, an American physician named Dr. Zeigler created a more selective form of what we know today as anabolic steroids. And in 1975, the International Olympic Committee, also known as the IOC, finally banned the use of steroids in Olympic competition. Black market or illegal sales continued to increase in the following years, and in 1988, the first major federal regulation of steroids was introduced as part of the Anti-Drug Abuse Act, which stiffened the penalties for the sale and possession of the drug, which then led to the Anabolic Steroids Control Act of 1990, which placed anabolic steroids into the Schedule III drug of the Controlled Substance Act, also known as the CSA, as of February 27, 1991. The possession or sale of anabolic steroids without a valid prescription then became illegal. Simple possession of illicitly obtained anabolic steroids carries a maximum penalty of 1 year in prison and a minimum $1,000 fine if this is the individual's first drug offense. The maximum penalty for trafficking is 5 years in prison and a fine of $250,000 if this is the individual's first felony drug offense. Major sports leagues such as the MLB, NBA, NFL, NHL, and every major sports league, including the IOC, the International Olympic Committee, as well as the NCAA, has banned the use of anabolic steroids as well as steroid precursors. Under this legislation, anabolic steroids are defined as any drug or hormonal substance chemically and pharmacologically related to testosterone that promotes muscle growth. The IOC and professional sports leagues use urine testing to detect steroid use both in and out of competition. So now we go on to methods of AAS use. So there's three main methods: injection, oral, and topical. So injection would be by use of a needle to inject the drug directly into the bloodstream, intravenously, or into the muscle, intramuscularly. Then there's oral through pills or gel tabs. And then topical, creams that are rubbed directly on the skin. And it's also seen in skin patches as well. And then here's just a few patterns of use that are seen to be popular. So there's cycling. The person takes AASs in cycles of 6 to 12 weeks, known as the on period, followed by 4 weeks to several months off. Stacking, users combine several different types of steroids or incorporate other supplements in an attempt to maximize the effectiveness of steroids, and this is called stacking. Lastly, pyramiding. Some users gradually increase the dose to a peak and then reduce the amount. Here are some side effects: men in white and women in the teal, the light green. So reduced sperm count, damage to the heart, impotence, difficulty or pain while urinating, and breast reduction and excessive hair growth for women. For short-term effects, with long-term effects including liver disease, development of breasts, shrinking of the testicles for men, and deepened voice, enlarged clitoris, and abnormal menstrual periods for females. And here are my references. And that is the end. Thank you for watching.